Kia ora koutou, and welcome to our WellSouth webinar on weight management medications. There is a wide range of weight loss medication in New Zealand, making it hard to know which to take, what to look out for, and how to manage the change sustainably. Our WellSouth dietitians and pharmacy team have pulled this webinar together to give you the fundamentals. Nat, Kirsty, and Lisa, who will introduce themselves in a moment, will review the medications currently available across Aotearoa. They'll explain how to manage your nutrition, what to eat, what to avoid, and generally what to expect. They'll also touch on some of the side effects and, importantly, what happens when you stop taking the medications. As you work your way through this webinar, feel free to pause and skip to the sections that are relevant to you. There is a lot of information, so take your time. Before we get started, let's introduce the team.
Kia ora, my name is Natalie and I'm a primary care dietitian at WellSouth. I'll be talking through some of the weight management basic strategies today, what to expect when you're on these weight management medications, and I'll also cover over some important nutritional factors to consider throughout your journey.
Kia ora, my name is Lisa and I'm a population health pharmacist at WellSouth. I will be talking through the weight management medicines currently available in New Zealand, including how they work and possible side effects from each of them.
Kia ora, my name is Kirsty and I'm a primary care dietitian at WellSouth. I will be talking through dietary considerations, side effect management, the importance of protein, and lastly, what happens when you come off these medications.
If you're considering using a medication for weight loss, it's essential to think about your lifestyle and what healthy practices you currently have. A healthy lifestyle and a balanced diet will set you up for long-term success. Weight loss medications work best with regular and balanced intake, ensuring that you're eating 3 regular meals a day, which are balanced in fibre, carbohydrates, lean proteins, and vegetables. This is really important as it helps to ensure you have 3 opportunities to add to your nutrition bank. It gives you more energy through the day and regulates your appetite, hormones, and hunger and fullness cues. Although they aren't diet focused, adequate physical activity and sleep and stress management is vital to good weight management. We know that those who have high levels of stress in their lives or are constantly fatigued or tired often reach for higher calorie-dense, nutrient-poor foods, which contribute to high weights. So managing these through speaking to other health professionals such as health improvement practitioners or mental health clinicians is important to your weight management and overall health. So once you have ensured that you have good lifestyle practices to help contribute to a healthy weight, you may be considering or have started on weight management medication. These medications can be used as a long-term option for managing weight when combined with healthy eating and regular exercise. We have 5 different weight management medications currently available in New Zealand, which our pharmacist Lisa will speak to in the next section of this webinar. Each of these medications work by reducing your appetite by acting on brain receptors, slowing stomach emptying to make you feel fuller for longer, regulating fat and blood sugar levels, and reducing your food cravings for calorie-rich but nutrient-poor foods. A lot of people report that they take away persistent thoughts about food, which is often unrelated to physical hunger, also known as food noise. Despite these benefits, we need to be mindful that these medications are not a quick fix. Weight loss is still dependent on the foods you eat and your physical activity level. We know that plateaus can happen and side effects are quite common, which include nausea, constipation, fatigue, and diarrhea. You can expect anywhere from 5 to 15% of body weight loss over 6 to 12 months, depending on the medication. Results are gradual and vary per individual. We also know that weight regain is likely after discontinuing with medication use if behavior and lifestyle change is not implemented through this journey and maintained.
Let's talk about the medications. As Nat mentioned in the previous section, we have 5 medicines available for weight management in New Zealand. In this webinar, I will provide a brief overview of each of these medicines. These medicines act in different ways, and the cost of each varies, ranging from approximately $80 to $600 per month. The costs shown in these slides are approximate, so it is always best to check with your local pharmacy. It's important to understand that not all weight management medicines are suitable for everyone. Individual factors such as medical history and current medicines need to be considered. For this reason, it is essential to talk with your doctor or pharmacist if you are considering starting any of these medicines. In your handout, you will find a link for more information on the weight management medicines. And of course, your doctor or pharmacist is always a good source of personalized advice and further information. Duromine or metomine contains the active ingredient phentermine. This is a stimulant medicine that acts directly in the brain to reduce appetite, helping you feel less hungry. It is usually taken once a day in the morning, as taking it later in the day can interfere with sleep. This medicine is only used short term, usually for up to 3 months. The cost is approximately $80 to $100 for 30 capsules. Duromine may not be suitable for everyone. It is usually avoided in people with heart disease, which includes high blood pressure, as well as those with diabetes, thyroid disease, epilepsy, or during pregnancy and breastfeeding. Some of the more common side effects include dizziness, increased heart rate, nausea, vomiting, sleeplessness, nervousness, and changes in bowel habit. Contrave is a combination tablet containing naltrexone and bupropion. These two medications work together to reduce hunger and control food cravings. The dose of Contrave needs to be increased slowly, which takes around 4 weeks. By the end of this titration period, the usual target dose is 2 tablets twice a day. It is best taken with food. The cost is approximately $250 for one box of 112 tablets. Some of the most common side effects include nausea, vomiting, dizziness, headache, dry mouth, changes in the way food tastes, trouble sleeping, and constipation. There is also a potential risk of mood changes, and it's important you talk to your doctor if you notice any changes in your mood or thoughts. Contrave may not be suitable for everyone. It is generally avoided in the elderly, people with heart disease, including high blood pressure, and during pregnancy or breastfeeding. It may also not be appropriate for people with certain mental health conditions or for those with or at an increased risk of seizures. It's also important to know that Contrave cannot be taken with opioid medications. This includes codeine, tramadol, or morphine. If you are currently taking opioids or have taken them in the past 10 days, starting Contrave can cause withdrawal symptoms. Orlistat, known as Xenical, reduces the absorption of fat. This means that some of the fat you eat is passed out in your stools rather than being absorbed into the body. Because of this, eating meals that are high in fat can increase the risk of side effects. These may include wind, stomach cramps, fatty or oily stools, and an increased number of bowel movements. This can sometimes present as a sudden need to use the toilet or passing loose stools. Due to these side effects, Xenical is not used very often. Xenical is taken up to 3 times a day with main meals. The cost is approximately $150 for 84 capsules. There are some situations where Xenical may not be suitable, including people who already have absorption problems, or conditions affecting the gallbladder, kidney, or liver, as well as during pregnancy or breastfeeding. Xenical can also interfere with the absorption of some medicines and vitamins, which may affect how they work. For this reason, your doctor or pharmacist will need to check if Xenical is appropriate for you, especially if you are taking long-term medications. Saxenda and Wegovy are medicines that are known as GLP-1 receptor agonists, often shortened to GLP-1s. Saxenda contains the active ingredient liraglutide and Wegovy contains semaglutide. These are currently the only two GLP-1 medicines available in New Zealand that are primarily used for weight management. Wegovy has the same active ingredient as Ozempic, which is used for weight management overseas, but this is not currently available in New Zealand. GLP-1 medicines work by suppressing your appetite, helping you feel full and less hungry. They also slow down how fast food moves through the digestive tract. Recently, these medicines have become some of the most talked about and commonly requested weight management treatments, mainly due to increased media and social media attention. Some people have reported drastic changes and labeled them miracle drugs. However, it is important to understand that everyone responds differently and results will not be the same for everyone. Both Saxenda and Wegovy are injections. Saxenda is injected once a day, with the dose increased slowly each week as tolerated. Wegovy is longer-acting and is injected once a week, with the dose increased slowly each month as tolerated. The dose used will vary between people depending on how well the medicine is tolerated and how effective it is for that individual person. They both cost approximately $500 for 1 month's worth. Saxenda comes as one pen with the ability to adjust the dose, whereas Wegovy has a different pen for each strength available, and as pictured, each strength pen is a different color. There are some situations where Saxenda or Wegovy may not be suitable. These include a history of pancreatitis, a rare type of thyroid cancer, use during pregnancy or breastfeeding, and use in older adults. The most common side effects of GLP-1 medicines are related to the digestive system. These can include nausea, vomiting, indigestion, heartburn, or changes in bowel habits. In the next section, our dietitian, Kirsty, will talk through some tips on how to manage these side effects that may occur when you use a GLP-1 medicine. There is also a very small risk of gallbladder disease or pancreatitis with these medicines. Some people may experience an injection site reaction, such as bruising, redness, or tenderness. To help reduce this risk, it is really important to use a new needle for each injection and to rotate injection sites.
Why is diet so important? More than 20% of people developed nutritional deficiencies within 1 year of starting GLP-1 medications. Eating well can help to protect your muscles and bone health. Changing your diet can support sustainable long-term weight loss. And lastly, adjusting your diet can help reduce common side effects such as nausea, diarrhea, or constipation. When you start this medication, it's common to get some side effects, especially in the beginning. These usually improve as your body gets used to it. Starting on a low dose and slowly increasing helps reduce side effects. Nausea is the most common, especially if you haven't eaten. To help with this, you can eat small, frequent meals, avoid high-fat foods, and don't skip meals. Ginger or peppermint tea may help. If it gets bad, you can talk to your GP about anti-nausea medications. Vomiting can sometimes happen after eating large meals. Try to eat smaller portions and slow down while you eat. Constipation is also common. Increase your fibre and fluids. We'll talk more about fibre later in the presentation. Fibre supplements or stool softeners can also help. Diarrhea can happen after large or high-fat meals. Try smaller portions and lower-fat foods. Fibre supplements can help firm things up. Your GP can advise on anti-diarrhea medication if needed. Most side effects don't last long. If they don't improve or keep going, make an appointment with your GP. When you lose weight, you can lose some muscle too. Looking after your muscles helps you stay strong and protects your bones. You can do this by eating enough protein and including strength-based exercises in your routine. Try to start each meal with 20 to 30 grams of protein. In the next few slides, we'll show you which foods are high in protein and what a meal with 20 to 30 grams of protein might look like, so you can see how to do this in real life. Try to do strength training 2 to 3 times a week. This can be as simple as using resistance bands, lifting weights, or doing body weight exercises like squats or lunges. Alongside that, aim for around 2.5 hours of moderate activity each week. This could include things like going for a brisk walk with the dog, a bike ride with the family, swimming a few lengths at the pool, playing touch or football with the kids, or joining a Zumba class. Start small and build up as you get stronger and fitter. If you would like extra support with the exercise, you can self-refer to Green Prescription. There is a link in your handouts. There are 4 main food groups. These are fruit and vegetables, grain foods, milk and milk products, and protein foods, such as beans, lentils, nuts, seeds, fish, eggs, chicken, and lean meat. The food groups that are highest in protein come from the milk and milk products group and the protein food group. Some grains and cereals also have protein, but usually don't have as much as the other 2 groups. Protein is really important at every age. It helps your body grow, repair itself, keep your muscles strong, and protect your bones. On the slide, you can see the New Zealand Ministry of Health's recommended servings of protein foods like legumes, nuts, seeds, fish, eggs, chicken, and lean meat. The amount you may need each day varies depending on your age and gender. For example, women aged 19 to 15 years need 2.5 servings from this food group each day. 1 serving could be 1 cup of chickpeas, 170 grams of tofu, 30 grams of nuts, 100 grams of fish, or 2 large eggs. The slide also shows how much protein is in each serving. You'll notice that meat, fish, and tofu usually provide more protein per serving. When putting meals together, try to include 20 to 30 grams of protein at each meal. When you're putting this into practice at meal times, it's still helpful to follow the healthy plate model, which includes plenty of vegetables, some whole grains, and some protein. The protein examples on the slide are the recommended serving sizes we talked about earlier. We don't expect you to weigh your food, so here are some easy ways to think about portions using your hand as a guide. For chicken or red meat, about the size of your palm and the same thickness. For fish, about the size of your whole hand. Or simply aim for a quarter of your plate to be protein foods. You don't need to remember exactly how much protein is in each food, but it's useful to have a general idea of which foods are naturally higher in protein and which ones might need a little extra added. For example, on the slide we have a quarter can of baked beans with 2 eggs. Baked beans on their own don't have enough protein to reach the 20 to 30 gram goal per meal, but adding eggs boosts it up. If you're using chickpeas or black beans as your main protein, you could add an egg, some cheese like Edam or cottage cheese, or a handful of nuts or seeds to help increase your protein. Whole grains such as brown rice, quinoa, or bulgur also provide some protein, so they can help contribute to your overall intake as well. Milk and milk products like milk, cheese, and yogurt are a good way to add protein to your diet. They are also rich in calcium, which is important for keeping your bones strong. As we age, especially after menopause for women and after 70 years old for men, our bone loss speeds up. This means older adults need more servings from the milk and milk products food group. On the slide, you can see the recommended servings by age and gender. For example, women aged 19 to 50 years need 2.5 servings per day, and women aged 51 to 70 years need 4 servings per day. Each serving gives you a good amount of protein. For example, milk has 8 to 11 grams, cheese has 11 grams for 2 slices, yogurt can range between 8 to 20 grams per serving. When choosing a yogurt, we want to try and pick the higher protein options. You can check the protein content on the 100-gram column of the nutrition label. Nat will explain this in the next slides. If you can't eat milk and milk products, then it's important you choose a high-protein milk alternative, such as soy milk, which has 6 to 8 grams per cup, or high-protein almond, soy, or oat milk, which contains 10 grams of protein per cup. Make sure your milk alternative product has calcium added to it. We've also sent some recipe resources that include lots of milk products or milk alternatives, such as smoothies, overnight oats, and chia puddings.
As we know, these medications work by reducing appetite. However, even though your appetite may be smaller, your nutritional needs remain the same. The main source of energy for your body is the food we eat, so it's important to keep fueling yourself throughout the day. One way to do this is by having smaller, more frequent meals and snacks. Regular eating helps to maintain your energy levels by continuously topping up your energy bank. Some great snack options include fresh fruit, a handful of unsalted nuts, or unsweetened yogurt. Including healthy fats in your meals and snacks is also important for sustained energy. Examples of healthy fats include olive oil, avocado, and oily fish. On the other hand, try to limit saturated fats. These are less healthy fats that are found in animal-based foods, such as the skin on chicken or the fat on a piece of steak. Trimming these off before cooking can help to reduce your intake. Similarly, you can swap butter for healthier alternatives like olive oil or margarine. Lastly, to help maintain steady energy throughout the day, include slowly digested carbohydrates in your diet. We'll talk more to these in the upcoming slides, but examples include potatoes, kumara, oats, and whole grain breads. These complex carbohydrates provide long-lasting energy, unlike simple carbohydrates such as white bread, pastries, or sugary foods, which can cause a quick sugar rush followed by an energy crash. One of the key differences between complex and simple carbs is their fibre content, which keeps your energy more stable throughout the day. Fibre is a type of carbohydrate that our body can't actually break down or use for energy. Instead of being digested like other carbs, it passes through our system mostly unchanged, and that's a good thing. This is because it helps to move food through our gut and form healthy bowel motions. Fibre plays a really important role in keeping our bodies healthy. Firstly, it helps to keep our bowel motions regular and prevent constipation, but it also helps to manage blood glucose levels and can lower our bad cholesterol, which therefore improves our heart health. Fibre also helps us to feel full and satisfied after eating, which can support in healthy weight management. And in the long term, a diet high in fibre can reduce our risk of developing bowel cancer. So as you can see, there are so many benefits to ensuring you have lots of fibre in your diet. Fibre is only found in plant-based foods, not in animal products like meat, eggs, or dairy. Good sources include whole grains, oats, brown rice, and wholemeal bread, as well as fruits, vegetables, nuts, seeds, beans, lentils, and legumes. So eating a variety of plant-based foods every day is the best way to make sure that you're getting enough fiber. As we discussed earlier, it's important to choose complex, slowly digested carbohydrates to maintain steady, long-lasting energy. This is because carbohydrates are our body and brain's primary source of fuel. When we eat carbohydrate-rich foods, our body's blood glucose levels, often referred to as blood sugar, rise as our body breaks down these carbs to release energy. These levels gradually fall again as our cells utilize that energy. There are two main types of carbohydrates, simple and complex, and the key difference between them lies their fiber content. Complex carbs are high in fiber and are generally found in foods that are close to their natural form, such as potatoes, kumara, beans, lentils, whole grains, and fruit. In contrast, simple carbohydrates are more refined and low in fiber. Examples include white bread, fruit juice, and potato chips. As shown in this graph, the whole grain bread, represented by the green line, leads to a slow, steady rise and fall in blood glucose levels, which you can think of as slow, sustained energy throughout the day. On the other hand, the white bread, shown by the blue line, causes a sharp spike in blood glucose levels, followed by a rapid drop. Because simple carbohydrates lack fiber, they're digested and absorbed quickly, leading to short bursts of energy, followed by a slump. So to support balanced energy and overall better nutrition, aim to include complex carbohydrates at each meal. This slide highlights some simple ways to boost your fiber intake throughout the day by making some easy swaps. For example, you might choose wholemeal pasta instead of regular pasta, brown rice instead of white rice, or add half a cup of lentils to your bolognese sauce instead of just using the standard version. Even something as simple as choosing a whole apple instead of apple juice can make a big difference. In general, opting for foods in their most natural form is the best way to increase your fiber intake and support better overall nutrition. On the right-hand side of the slide, you'll see two tables. These are nutrition information panels, which you'll find on the back of packaged goods. These panels are a great tool to help you compare products and choose the healthier option. The nutrients are listed down the left-hand column, and you'll notice there are two sets of numbers, the per serving and per 100 gram columns. I recommend using the per 100 gram column when comparing foods, as serving sizes vary between brands and can make comparisons tricky. In this example, the white bread contains 2.4 grams of fiber per 100, whereas the brown bread provides 5.9 grams per 100, more than double the amount. Since fiber helps to slow the rise and fall of our blood glucose levels after eating carbohydrates, it's best to choose the higher fiber option where possible. Finally, you'll notice a small logo at the bottom right-hand corner. This is for the Food Switch app. It's a handy tool that lets you scan food products and receive suggestions for healthier alternatives, making it easier to make informed choices while shopping.
Staying hydrated is also important for good health. Some weight management medications can cause vomiting or diarrhea, which can make you dehydrated. Try to drink about 8 to 12 glasses of fluid each day and let your doctor know if you're struggling to keep fluids down. The chart on the slide shows you a way to check your hydration by looking at the colour of your urine. The lighter colours mean you're well hydrated. Foods that contain a lot of water in them, like cucumber, watermelon, and soups, can also help contribute to your fluid intake, but drinks are still the main way to stay hydrated. Try to limit alcohol, caffeine, and sugary drinks, as these can make it harder for your body to stay hydrated. Let's talk about what happens when someone stops the medication. It's normal to regain some weight, and most of it's usually body fat. Your hunger and fullness cues also come back, and your appetite might feel quite strong again. So how can we reduce weight regain? Strength training helps to protect your muscles. Eating a balanced, healthy diet is key. Foods that are high in fibre and protein can help keep your appetite under control. Managing cravings is easier if you eat regular meals and focus on including plenty of nutritious foods throughout the day. Using these strategies can help support long-term success, even after stopping the medications. Healthify is a great website for trusted information and resources on a wide range of health topics. Health improvement practitioners, or HIPs, are free to see at many GP clinics. They have a background in mental health and can help with stress, anxiety, sleep, or habit change. Health coaches are also free and based in some GP clinics. They support people to make positive lifestyle changes and improve well-being. We've created a screening tool for health coaches to help make sure you get the right support while on weight management medication. Green Prescription Program helps you to increase your physical activity and build healthy habits for long-term health. It's free and you can self-refer online through the Active Southern website for Southern or Queenstown people, or Sport Otago for people based in Central Otago or Dunedin. We will give you access to a list of helpful links and tools for people using weight management medication. Here is a list of the references we used when creating this webinar.
Thank you, Nat, Kirsty, and Lisa. If you have any questions or continuing concerns, contact the team on email at dietitians@wellsouth.org.nz. You'll see the address there on your slide. Or talk to your usual healthcare professional. Finally, we'd love some feedback on our presentation. Please click on the link provided on the webpage. Take care, keep well. Noho ora mai.